cohort to study factors affecting mucosal recovery in celiac disease. Dr. Duerksen will be discussing what tests are available to assess your nutrition and why it's important to manage your nutrition in celiac disease. So with that, I'm going to hand over to Don Duerksen.
So thanks, David, very much for the introduction. And thank you also, Mark, for chairing the conference yesterday. I'm going to switch to my desktop here and just make sure that we get things organized. I'm hoping everybody can see my PowerPoint slides.
Yes.
Perfect, thank you. So I was asked to talk a little bit about nutrition assessment in celiac disease. And what I'd like to cover in the next 15 minutes is ways in which we can assess nutritional status. I'll talk a bit about body composition, what happens when people with celiac disease go on a gluten-free diet, maybe understand some ways why people could lose weight on a gluten-free diet, and then talk a bit about blood testing and nutrition assessment and what we know about that. So we'll go quite quickly and hopefully give you an overview of these topics. So when we talk about nutrition assessment, I think people have different things in their minds when we say that. And I think what a lot of people will think about is whether or not they're undernourished. In other words, if someone is malnourished, is it because, is it an undernutrition? Do they lack calories? Do they lack protein in particular? Another way of looking at it is, are they overnourished? So we know that health risks go up if people's weight is too high, so, which is where obesity comes in. And so it's possible to be undernourished, it's possible to be overnourished, and it's also possible to have deficiencies in vitamins and trace elements and minerals. And I'm going to leave that topic completely for Ines to talk about next. So I'm not going to talk at all about that, but I am going to talk a bit about undernutrition and a bit about overnutrition. So when we think of undernutrition, it really occurs if there's an imbalance between energy and protein intake and expenditure. So we take a certain amount in, we then absorb it, and then we burn a certain amount up. And in general, most of us are in some type of balance where the ins equal the outs. Our absorption processes are quite efficient, and so we absorb most of what we take in. That does change, of course, in celiac disease when absorption may be affected, so that could be a factor. And intake may also be affected in celiac disease because of GI symptoms. You know, what are the best ways that we can determine if someone is malnourished? And people have looked at, you know, is it by taking medical history? Is it by doing a physical exam? Is it by doing a body composition test? Things like skin fold thicknesses, or now we have a bioelectrical impedance, which is passing electrical current through different tissues to see how much fat or how much fat-free mass people have, or there are laboratory tests that we can do. And I'm going to tell you from the outset, it turns out that these latter two aren't that helpful when it comes to determining whether someone's undernourished. And really, the factors that seem to be most important in classifying people are this medical history and the physical exam. And what's really important is whether people have lost weight. So unintentional weight loss, and this has been studied in many different areas, is a factor that's associated with adverse outcome. So it's very important that if people are losing weight unintentionally, again, something that we're going to talk about in a bit, certainly is a symptom that people with celiac disease do develop. If people have decreased intake, and usually that intake is decreased because of either a lack of appetite or specific symptoms, and then when you look at them and were to examine them, you find that they've actually lost muscle mass and fat mass. And this combination, really, if people have findings in this regard, there's evidence that they're simply malnourished. And in the 1980s, Dr. Gigi Boy from Toronto actually developed this grading scale called the Subjective Global Assessment that classified people into either being well-nourished, mildly malnourished, or severely malnourished, SGA A, B, or C. And this is something that we use a lot today. This is what it looks like if we were to put a form to it. Again, nutrient intake is important, weight loss is important, symptoms that affect intake are important, things like functional capacity and whether people are burning a lot of energy, and then a physical exam looking at loss of body fat and muscle mass. And a lot of nutrition practitioners, certainly in Canada and across the world, use this. Many dietitians use it, many physicians use it. And I'd like to propose that it's something that we should be doing in individuals with celiac disease. When it was initially developed, it predicted outcomes. So people that were malnourished had a much worse outcome than those that weren't. And subsequent to that, many other conditions have been validated, things like chronic kidney disease, heart disease, geriatrics, elderly patients, in-hospital medical patients, ICU patients, and patients with cancer. It's interesting that it has never been officially validated in celiac disease. I have no reason to think it wouldn't be valid, but there haven't been specific studies looking at SGA and celiac disease. It is the assessment tool that dietitians in Canada use when people are admitted to hospital and they are determining whether an individual is malnourished or not. So, what about malnutrition and celiac disease? I've emphasized the importance that weight loss is a real indicator. If we look back at the CCA survey that was conducted in 2002, that had 2,681 biopsy-proven adults, 69% of them stated they had lost weight prior to their presentation of celiac disease, suggesting there was some degree of malnutrition in a large majority of individuals. This was published in 2007, and this is a bit of a plug for the current survey, which we're repeating now in 2022. Has a lot of the questions that we used back then. We want to see if things have changed, and there's some reason to think that maybe things are changing in various aspects, one of them being how people present at diagnosis. When we think about diagnosis, and there was an Oslo definition that was characterized back in 2018, we talk about classic symptoms and non-classic symptoms. The classic symptoms are those that relate to diarrhea and evidence of malabsorption. So diarrhea, weight loss, and malabsorption are really the foundation of the classic symptoms. And you can see the non-classic symptoms. Many of you are quite aware of them, and many of you may have had some of these symptoms. And as time goes on, perhaps because of increased recognition, we are finding that many patients are presenting with these non-classic symptoms. And certainly in my experience, I'm probably finding more patients with the non-classic symptoms than those with the classic symptoms. If I think back of people with really profound malnutrition, it's probably been about a decade or so that I've seen someone who's really been in that severe SGAC category, whereas in the past I was seeing more of that, and it may be a tribute to picking people up more frequently and also being much more aware of these non-classic symptoms, and hopefully we're better at identifying some of those individuals. There has been recently, there was a paper in Pediatrics looking at the changing presentation. This was a group from Israel that looked at 2 decades. One was from 1999 to 2008, the other one from 2009 to 2018. And they divided into these 2 time periods, and they found that compared to the earlier time period, weight loss was less common in the presentation in the latter decade, just over 20% versus about 35%, and that abdominal pain seemed to be more common, and the asymptomatic presentation was being increasingly recognized as time goes on. I couldn't find a good large adult study, but I would guess that it would mirror this. And as I say, I'm hoping that we will be able to give you more information once we have our survey results from this year. What about the nutritional status of people with celiac disease following gluten-free diet? So they've been diagnosed. There's a couple of possibilities. First of all, there's certainly a possibility of gaining weight and perhaps gaining too much weight and becoming, in quotations, overnourished. This is because nutrients are absorbed better. And when people switch their diets, depending on their food choices, their caloric intake may increase and their type of food intake may increase. So that could lead to perhaps risks of becoming overweight or obese. The other possibility is that gluten-free diet is restrictive. So people have to avoid certain foods, and these food restrictions may lead to decreased intake of certain nutrients, and depending what or they're being replaced with, maybe people could possibly lose weight with the gluten-free diet. So things could perhaps go either way. And what does the literature tell us about what happens on a gluten-free diet? Just by way of a reminder, when we talk about overweight or obesity, we talk a lot about body mass index. This is a scale that is a measure of weight over height squared. So it's really a weight for a certain height. the weight in kilograms, the height in meters. And you notice the normal range of a BMI is between 18.5 and 24.9. Overweight would be 25 to 29. Above 30 would be obese, and below 18.5 would be being underweight. So that's just to remind people, this is the scale that we use. And there was a recent systematic review. There have been quite a few studies that looked at that, looked at cohorts of patients, and systematic review takes all these studies, puts them together, and tries to draw some conclusions to what happens. And the first thing this review looked at is, okay, what about the body mass index at diagnosis of celiac individuals compared to those people that would be matched? So people that are the same age, same sex, similar medical conditions other than celiac disease. And it turns out, this is called a forest plot, and anything to the left of 0 would mean that the celiac patients would tend to be have lower BMI. So this forest plot showed that, in fact, on average, and again, there are exceptions, but on average, people with celiac disease do have a lower BMI compared to controls. Not surprising, given that a lot of people present with weight loss. What happens after a gluten-free diet? It turns out that the BMI does increase, and you can see that, again, looking at the forest plot, here's 0, we're to the right of 0, so there is a higher BMI during a gluten-free diet on average to individuals. You can see the individual studies are shown above here, and there's quite a variation and a range within all of this. And when you look at it a bit more closely, it's interesting that about 9% had significant weight increase, and their category changed from a normal weight to one of being overweight or obese. So this was very relevant to about 10% of people, and there were 20% of people that lost significant enough weight that they actually lowered a BMI category, according to what I had just shown. So the data tells us that both of these things can happen. People can gain weight during gluten-free diet. They can also lose weight during a gluten-free diet. And this just summarizes what I've just said and what these data show. And to me, this really points to the importance of seeing a dietitian when a gluten-free diet is started. I think we obviously suggest that in order to learn more about gluten-free diets and how to adhere to gluten-free diet and label reading, which are really important. The other thing that's very important is to adopt a gluten-free diet that's healthy, that does contain the relevant food groups that was talked a little bit about yesterday, and we'll probably talk more about it today. And I think it's a plug that I think it's very important that people get connected with dietitians that can guide people in the right direction. Now, that's a bit what happens to weight. What about body composition? How does that change? I mentioned earlier that we can test body composition with different devices and different methods. There's another systematic review and meta-analysis that was published recently that looked at patients that were checked at diagnosis with respect to body composition, and then on a gluten-free diet at least a year later, what happened. And it turns out that fat mass increased significantly, 4 kilograms compared to baseline. So, people were underweight to begin with. They gained fat mass compared to baseline. But if you follow them out and you compare them to controls later on, they end up still having less fat mass than controls while on a gluten-free diet, and also less fat-free mass. So body composition changes don't normalize completely. You don't go on a gluten-free diet and become completely similar to individuals who would be controlled as, again, age, sex matched controls. Is this good? Is this bad? I'm not sure. I think all we know is it doesn't change completely, and there's again a big range within that. So I mentioned a bit about lab testing. We've always wished that we had a really good blood test that would say you're malnourished and you're not. One of those tests was the serum albumin. In fact, some of my colleagues still think that albumin may be a good marker. It's probably not a good marker of nutritional status. What it really is a marker of is physiologic injury. So if people have an inflammatory disease, things like Crohn's disease, colitis, pancreatitis, they're admitted to hospital, their albumin decreases significantly. Other conditions affect the albumin levels, such as kidney disease, liver disease, heart disease, malabsorptive disorder. So there's a lot of factors that affect it. Just to, again, to show that in fact, it doesn't really seem to be a marker in celiac disease. This is data from our inception cohort of taking people at diagnosis, following them at 6 months, 12 months, and 24 months. And we measured both their total protein at baseline and their albumin. And you can see, and if I just focus on the albumin at diagnosis, only one person had a low albumin, less than 30, and the mean albumin was 40. At 6 months, there was no one that had a low albumin. At 12 months, 2 people did, and at 24 months, no one did. And again, these abnormalities were not related to celiac, but to another condition. And same thing with the total protein, they really don't change much. And so albumin is not, this is despite the fact that many of these individuals in this cohort had lost significant weight and had some degree of malnutrition. So unfortunately, we don't have a good blood test that tells us whether someone's malnourished or not, and it emphasizes the importance of having a good history and physical exam to look at things like weight loss and loss of muscle mass. One of the clinical problems that does come up, malnutrition does occur in people that have celiac disease and are on a gluten-free diet. They lose weight. And I think there are many possibilities when this happens. So just to give you a brief overview of what would go through my head if someone comes to my clinic with that, the first thing we always think about is there gluten exposure? Is there active celiac disease that is impairing absorption or causing symptoms and resulting in that weight loss? The other thing, which is uncommon, probably less than 5%, but can happen, is something called refractory celiac disease, where the gluten-free diet doesn't work. There's one type which responds potentially to immunosuppression and steroids. There's a second type that is associated with T cell abnormalities and a potential lymphoma. In particular, if people have really profound weight loss, this is something that needs to be ruled out. And I'm not going to go into it in great detail, but this is something we certainly think about, but is quite rare. There are other conditions that are associated with celiac disease, things like microscopic colitis. Some patients get a lot of diarrhea and they can lose some weight. There is a slightly increased risk of pancreatic insufficiency and bacterial overgrowth, which we'll think about. There are conditions which are completely unrelated to celiac disease, resulting in weight loss. And then finally, there's 2 things which I'm happy to see that we're talking about today that could influence weight. And one of them is disordered eating, and the other is food insecurity. So it's something that, again, weight loss suggests to me that there is an element of malnutrition. And in the context of celiac disease, there are many different things that could be contributing to that. And it does require a detailed assessment to further assess that. So I just want to summarize by saying that the best way to assess someone's nutritional status in celiac disease is with subjective global assessment, which looks at weight loss and changes in muscle mass. We see it commonly at presentation of celiac disease, but I think probably non-classic presentations are becoming more common. Hopefully we're getting better at recognizing them. Body composition, weight changes, and weight change on a gluten-free diet. And it's important that we assume a healthy gluten-free diet. And if weight loss does happen, it does require a detailed assessment and investigation. And with that, I'll conclude, David, and I'll turn it back to you. And I think we're going to probably be taking questions as a group later.
Absolutely. Thank you very much indeed, Don. That was